The coronavirus situation in Kenya is getting worse. The hospitals are overwhelmed and the doctors and nurses attending to patients have had it. After losing one too many colleagues, the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, have said that they're pulling the plug in hospitals, so to speak, in the end if their demands are not met in 3 weeks' time.
In response to this, the Health Cabinet Secretary, Mutahi Kagwe, has called an extraordinary meeting of the National Emergency Response Committee, which he will chair tomorrow. Anita Nkonge shares the agenda of that meeting and the suffocating frustration of the healthcare workers.
Yesterday saw 4 senior doctors passing on in the span of 24 hours due to COVID-19 complications. That's not all. The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, says that the battle at the COVID warfront has proven even more difficult due to lack of support and has seen 30 healthcare workers succumb to the virus. To put this into perspective, the loss of doctors who are trying to save lives would further drive up the COVID-19 death toll that is now close to 1,300 in Kenya.
Governments across the world have come out in full support of their healthcare workers. In our country, the neglect and working environment has resulted in the loss of now over 30 healthcare workers. There have been bills of up to 2 million of ICU care of healthcare workers. Those bills have been sorted through fundraising by all healthcare workers, not the government.
The KMPDU also says that attempts by the judiciary to try and trump their strike will not be welcomed.
We are the soldiers in this war, and if you issue orders against this notice, then that order shall be a piece of paper.
Following an emergency special national advisory meeting today, the KMPDU has laid out its terms, which, if not met, would lead to a paralyzing strike. They include the provision of standard and adequate PPEs in all facilities in the Republic of Kenya, comprehensive medical cover for all doctors, enhancement of existing risk allowance paid to doctors, and a Constitutional Health Services Commission. These conditions given by the healthcare workers will most likely form the agenda for a special meeting of the National Emergency Response Committee that has been set for Monday. The Ministry of Health says the meeting is in response to the rising COVID-19 cases with an aim to review the containment measures and the concerns raised by healthcare workers. Today's 3-week strike notice comes as doctors caution that hospitals across the country are overwhelmed.
We note with concern that the political class and the leadership of the country has assumed and neglected the plight of Kenyans. Their political activities are increasing the numbers of COVID-19 cases who go to overstretched health facilities and equally increasing the burden of the doctors in the facilities who continue to work with very minimal support from the government.
Though it was believed that a majority of the counties had reached the 300-bed capacity for isolation, a supposed condition for partial easing of the COVID-19 restrictions, sources at the KMPDU say that this threshold has not been reached, but is only the case for general medical conditions. Anita Nkonge, NTV.